Welcome to the RADAR study. Our research focuses on changing the way dialysis is performed to reduce the risk of heart problems and complications. This study is being conducted at the NYU Langone Medical Center under Dr. David Sheridan and at the Duke University Hospital under Dr. Patrick Punn. Before we get into the details of the study, let's hear a brief message from the doctors.
Hello, my name is Dr. Patrick Punn, and I am a nephrologist at Duke University. I also conduct clinical research studies to learn how we can make things better for kidney patients. I really want to thank you for taking the time to watch this video. We all know that patients with kidney failure depend on dialysis and cannot survive without it. However, we also know that dialysis has a lot of room for improvement. Many dialysis patients develop heart problems, and one of the most common and serious heart problems that patients on dialysis have is an increased risk of developing abnormal heart rhythms called arrhythmias. When these heart rhythm problems are severe, a condition called sudden cardiac arrest can occur, where without warning the heart suddenly stops beating. Sudden cardiac arrest is actually the #1 cause of death in dialysis patients. Many of the abnormal heart rhythm problems that dialysis patients experience are linked to having too much or too little potassium, acid, and fluid levels in the body, and to how these substances are removed during dialysis. Unfortunately, right now no one knows the best and safest way to remove these electrolytes and fluid levels during dialysis in order to decrease the risk of heart problems and heart arrhythmias in dialysis patients. That's why I have teamed up with Dr. David Sheridan at New York University to design a clinical research study called the RADAR study to try and answer this really important question. We are conducting this study at your dialysis center in partnership with your regular dialysis doctors to help us learn more about how to make dialysis treatments better and safer for everyone that will minimize the risk of heart rhythm problems. In the RADAR study, we will compare how several different ways to remove electrolytes and fluid on dialysis affect the heart rhythm by using a special device to monitor heart rhythms during dialysis treatment. This information will provide us with a better understanding of how to improve dialysis treatments and make dialysis safer for everyone. Your doctor has suggested that you might qualify to participate in the RADAR study. It is up to you whether or not you want to participate in the study, and whatever you decide will not affect your overall medical care. The research study may or may not help you directly, but it may help other patients like you down the line as we learn more from the study. The rest of this video will explain more about what's involved in the RADAR study. A member of our study team will also be available to answer any questions that you may have. Again, I really want to thank you for taking the time to learn more about this important research study, and I hope you will consider participating. Let's review eligibility for this study. To be eligible, you must be between the ages of 18 and 85 and on dialysis for over 30 days. Your participation is voluntary, and if you choose not to participate now or at any time, this will not affect your medical care at all. A small device will be implanted by a cardiologist just under the skin and is smaller than a paperclip. The device looks like this. At the first study visit, we will review and sign consent and check if you meet the eligibility requirements. At the second study visit, the cardiac monitoring device will be implanted under the skin during a 15-minute procedure at Duke Clinic. The next visit will be a follow-up visit within 1 week of the procedure to check on how you are doing. 30 days after this procedure, we will start the trial at your dialysis center. This study compares 4 different ways of adjusting the dialysate bath. Each treatment will last 1 month. A blood test will be drawn from your dialysis axis before each dialysis treatment. Your heart rhythm will be monitored for 4 months. At the last study visit, you will be given the option to remove the monitoring device. This is optional. You may keep the device and heart monitor if you choose. Finally, you will have an optional follow-up visit within a week after the device is removed. Here are some other things to think about before participating. Possible risks. Risks of the study are associated with the changes made to your dialysis prescription and implantation of the monitor. There are other risks that the study team will review with you in more detail. The study will ensure all personnel involved in the study are highly qualified and trained. Potential benefits of the study. You may benefit from early recognition of electrolyte abnormalities and reduction in arrhythmias. Compensation is also provided for your time participating in the study. Thanks for watching this video and for your interest. Please contact us with any questions or concerns using the contact information below.